Good evening, good night. Anybody can hear me? Anybody can hear me? Okay, if you can hear me, just let me know, please. Just let me share the session with other doctors and nurses. Then we will start, okay? Just let me share the session with other doctors and nurses. Then we can start, please. If you can share the session with other doctors and nurses and pharmacists, that would be great, okay? Okay, 27 people are there. Just Okay, thank you so much for waiting. So, thank you. So, now let us start. I was just sharing the session with other doctors and nurses. So, now let us start. If you can hear me, just let me know. So, if you are new, okay, but I'm not new, okay. So, I'm old OET teacher. This is my page, DrChe Medical English. So, we have YouTube channel. You can just search on YouTube DrChe OET and then you can find my channel there. There are many, very useful OET videos there. Okay, so today as our focus is on reading, so most probably we will do reading part A and some questions for reading part B. Okay, this is reading part A. This is my own sample. Okay, can you hear me now? This is my own sample. Okay, so if you can hear me, just let me know in the chat below. Okay, yes, okay, thank you. So the thing is in part A, what is the strategy for part A? For reading part A, OET reading part A, what is the main challenge in this? Okay, the main challenge, okay, let me write here. Let me make it bigger. Okay, main challenge in reading part A is the time management. If you if you are able to answer all the 20 questions, because we have 20 questions and we have only 15 minutes. We have 20 questions and we have only 15 minutes. Okay, it means less than 1 minute for one question, almost 45 seconds. So it means 45 sec for one question. Okay, so it is not easy without practice. Without practice, it is not easy. So many people keep doing samples. Okay, many people keep doing a lot of samples and samples. At the end, okay, they improve, but the main thing is doing samples is very good, but the main thing is you need to understand what the examiner wants from us. Okay, in reading part A, B, and C. If you try to focus on these things, how they make the questions, how how the examiner makes questions, how we need to find the answer, okay, and which type of questions, for which type of questions, where we can find the answer, and how to find the answers and how to manage all the things within 15 minutes, within 15 minutes. Even I will say 14 minutes because 1 minute you will not be able to answer questions from at the start 30 seconds, at the end 30 seconds, you will not be able to answer the questions. So the main thing is, thank you so much, all of you. So the main thing is time management. I have my students, okay. I took a reading course, I think was in uh, May or June, okay. 22 reading course, and many students passed their reading uh, module. The thing is that I was teaching them how to approach the questions, okay. So how to approach the questions, okay. So now let us move to part A. So time management is very important in part A. And what is the strategy? Thank you so much, Huma. Miss Huma, thank you. Actually, I was busy in my exams and a little bit, not I was not available for live classes, free classes. So in part A, what is strategy? Some of you are new. Okay, so just in part A, what is strategy? In part A, believe me, if you keep working hard, especially nurses, if you keep working hard and hard and hard in reading, I can't improve, I can't improve, I can't improve. I have my nursing students who in writing they were just 250, 220, 270 at this. They have taken the exam 3 or 4 times. They were not able to pass. But after they took my course, even they got B grade. Their required was C plus, but they got B grade. The reason is you need to focus on the things, okay, the main things, the core of the things, okay. So how we approach part A, how we approach part A. So different people have different strategies. The strategy that suits me better and most of the students is first skim and scan and then read the questions, okay. What strategy? Can anybody write? First skim and scan, then read the questions. First skim and scan, then read questions, okay. Okay, so anybody can tell me how much time we should spend on skimming and scanning? Anybody can tell me how much time we should spend on skimming and scanning? Thank you so much. Thank you, all of you. So how much time we should spend on skimming and scanning? How much time? Anybody can write in the chat how much time we should spend in skimming and scanning. How much time? 30 seconds. Okay. Anybody? 2 to 3 minutes. 1 to 2 minutes. Okay. Dr. Satish saying, okay. Dr. Nadeem is saying 60 seconds. Okay. Okay. So on average, I will say 1 to 2 minutes. Okay. It can be a bit less. It can be a bit, okay, more, but 1 to 2 minutes is okay. 1 to 2 minutes is 1 to 2 minutes. Okay. Skimming and scanning in 1 to 2 minutes. Please believe me, you can do hundreds of, you have you have heard many students. I have done all the gesture file 1 time, 2 times, 3 times, but still I am getting C, C plus in the real exam. I don't know what should I do. Even only with gesture files, people get B grade, but many people don't get B grade. The thing is, they don't know how to approach the questions. Okay, so 1 to 2 minutes for skimming and scanning. Okay, so this is a sample. Reading part A sample. This is my own sample. Okay, I you know I have prepared my own course, and I almost 20 to 30 part A questions I have written and part B also. Then I need to work on those. Okay, skimming and scanning. Okay, anybody can tell me what you will see on skimming and scanning? This is, you can see, this is omeprazole. Everybody knows, every doctor and nurse knows that what is omeprazole. This is the medication. Okay, so what do you need to skim and scan in this? Okay, skim and scan 1 to 2 minutes. So how you will skim and scan in 1 to 2 minutes? Okay, quickly, how you will skim and scan quickly in 1 to 2 minutes. How you will skim and scan quickly in 1 to 2 minutes. Okay. So first of all, I know that this is omeprazole. Okay. So we need to see the headings, subheadings, and the main things. Okay. First sentence of the uh, paragraph, last sentence, first sentence, any date, any main thing in between. Okay. So now let us say skim and scan this one. Okay. This is the omeprazole, and this is text A. Here in the text B, we have algorithm about diagnosis and treatment of refractory. Look at this word, refractory GERD. Okay. So this is the use of PPI, omeprazole, in refractory GERD. Okay, in diagnosis and treatment. Okay. So I will tell you what to see there. And text C is cautions. Everybody knows that when you are using any medication, you have to take care of something. Okay. So these are the cautions. So this is a text C. In text D, if you see that I have two subheadings. One subheading is long-term use, and other subheading is pregnancy and breastfeeding. So overall, I can say that in part A, this would be overall about omeprazole. What is omeprazole? It is what is used for. Okay, just what is the class of omeprazole and these things. Okay, general questions means information here. Then we have algorithm of diagnosis and treatment of refractory GERD. Okay, GERD. Okay, and then we have cautions. And then in part D, we have long-term use and we have pregnancy and breastfeeding. It looks very long text, but it is very easy to quickly skim and scan. Okay. Now let us skim and scan part A. Okay. Let us quickly skim and scan part A. Anybody can hear me? Just write something in the chat so that we are aware that people are listening. Okay. So in text A, acid is produced naturally in the stomach. Acid is irritant. Okay, not read the complete. Okay, in some people the barrier can break. Okay, you see they're talking about barrier in the stomach. Other people they have problem with muscular band, acid reflux here, proton inhibitors such as this one. So there's a mechanism of action how they are. Okay, they prevent ulcers, and by decreasing the amount of acid, omeprazole giving one part of treatment. H. pylori here. On prescription, you can also buy short course omeprazole at pharmacy for the reflux symptoms in adults. Okay. So what is in the text A here? What is in the text A? In text A, they're talking about overall what is omeprazole. Okay. Then how the stomach ulcer produces. What is the mechanism of how the stomach ulcer is produced, and then how this class of medication acts, and then where we use it. Okay, these are the things in part A. Then we have part B. Okay, quickly skim and scanning. Okay, so here is PPI once daily for 2 months. If they have any alarm symptoms, then we need to do upper endoscopy. Okay, if there is a failure, review. If again fail, then review twice daily, PPI twice daily for 2 months. Okay, switch to another PPI for 2 months. Okay, if again fails, then and for twice daily. Here you can see is review proper dosing once daily here twice daily. Here is empirical therapy, no access to esophageal impedance, and here is esophageal impedance plus pH. If you can do these tests, okay, then go for pain modulator, review again, then TLESR reducers, pain modulator, and H2RA at bedtime, anti-reflex surgery. Okay. And here, if we have heartburn, empirical therapy, then this time at bedtime, and pain modulator, and these things. Star means partial and complete relief of symptoms. Okay, this is quick skimming and scanning of part B. Here are the questions in the part C associated with incidence of Clostridium difficile diarrhea. Dose liver disease, in liver disease reduce okay the dose. Cutaneous lupus, okay, so it's a role in cutaneous lupus. Gastric carcinoma tumors, okay, it causes these tumors, okay. Magnesium deficiency and meprazole, and here is clopidogrel, it's a reaction with clopidogrel. Then acute nephritis, then we have symptoms gastric malignancy, okay. May elevate and prolong serum concentration of methotrexate, and then okay. Then in text D, we have long-term use when we use long-term, okay. So the development of benign polyps here, okay, quickly. There are no association with PPI and cancer. Possible association with dementia here is dementia. Here is calcium absorption, decreased magnesium absorption. So here they are talking about absorption of different, you know, chemicals, magnesium and these things, okay. So then we have breast pregnancy and breastfeeding. The safety of immunization has not established in pregnant and breastfeeding women. Epidemiological data does not show an increased risk of major birth defects. Okay, no clinical trials. Omeprazole has a high plasma protein binding rate. This, okay, transfer to milk. Okay, needs to be administered in an entire coating formulation due to rapid degeneration in the acidic condition of the stomach. Okay. At normal doses is likely safe during breastfeeding. Okay, done with skimming and scanning. Okay, now in the part A, okay, this is first 7 questions. You have to find out in which text you can find information about. In which text you can find the information about. So the first question here is, in which text you can find the information about role of omeprazole in birth defects? In which text? In which text you can find the role of omeprazole in birth defects? Where you can find, in which text? Quickly, please, quickly. I am seeing your chat, okay, quickly. So role of omeprazole in birth defects, in which text we can find? When you have done skimming and scanning, you should have got an idea, okay, where you can find, okay. Some people are saying part A, some people are saying part D, okay, means text D, text A, okay. So Miss Sadaf D, Saika Khan D, Hirani, Dr. Hirani D, okay. Okay, so now let us try, okay. So somebody said part A, okay. Let us go there and quickly see, okay. Somebody is saying C also. So in part A, so role of omeprazole in birth defects, okay. So try to, what is the keyword here? What is the keyword in this question? What is the keyword? The word that you will find in only one text. What is the keyword here? What is the keyword? We have 1, 2, 3, 4, 5, 6 words. Which 1 or 2 words are the keywords here? Birth defects, very good, okay, very good, okay. Birth defects, okay. So let us see in text A if there is any mention of birth defects, okay. A digest, kill bacteria, irritant, causing inflammation, stomach, esophagus, acid reflux, PPIs, their mechanism of action, pumperazole, okay. So available on prescription, okay. So Is there any mention of birth defects in text A? Is there any mention of birth defects in part A? Any mention of birth defects in part A? Okay, there is no mention of birth defects. Okay, nothing about birth defect. This is how you need to find quickly. Okay, so now here is not possible in B, no. Somebody told that, let us see in C. Okay, this is diarrhea, Clostridium diarrhea. This is about liver disease. This is about cutaneous lupus erythematosus disease. This is about systemic carcinoid, and so we have bullet point: magnesium deficiency, F-clopidogrel. Here nephritis. Here we have gastric malignancy. Here we have methotrexate. Okay, is reaction with methotrexate. Okay. Is there any mention of birth defects in part C? Any mention of birth defects in part C? Okay, if anybody finds it a little bit, text is, small in size, you can rotate. Okay, you can rotate your mobile. Okay, just make a landscape. Okay, horizontal. Okay, so you can see the text a little bit bigger. No birth defects. Okay, so now you will tell me that where you can find in text D. Okay, text D has two parts: long-term use in pregnancy and breastfeeding. Okay, so try to find here role of omeprazole in birth defects. Okay, I have to make it small. Okay, try to find here, please. Okay, where you can find exactly in text D, where, which paragraph, which head, subheading. Role of omeprazole in birth defects, in which paragraph? Okay, Dr. Satish is saying pregnancy and breastfeeding, second line. Okay, very good. So this is pregnancy and breastfeeding, and here is the answer. Okay, so epidemiology data don't, okay, it should be does not, okay, don't show an increased risk of major birth defects after maternal use of omeprazole during pregnancy. You can see the paraphrasing. Okay, paraphrasing. Here is role of omeprazole in birth defects. And here they are saying that epidemiological data does not show an increased risk of major birth defects after maternal use of omeprazole during pregnancy. This is called paraphrasing. The same thing, the same thing, the same thing they are writing in little bit short form. Okay, role of omeprazole in birth defect. So role of omeprazole in birth defect would be in paragraph D. Okay. Okay, now question number 2. People believe me, if you follow and you try to find and you make the logic, okay, how I need to find the answer, how quickly I find the answer, where to find the answer, these things, if you make a habit of these things, you can easily pass the reading module. Otherwise, forget about it. Okay. Steps to follow when reflex symptoms don't respond to conventional treatment. In which text it is possible? In which text it is possible to find the answer? Steps to follow when reflex symptoms don't respond to conventional treatment. Okay. Which steps we should follow when reflex symptoms don't respond to conventional treatment? What are the keywords? What are the keywords? What are the keywords here? People try to focus how the examiner, because these questions were made by myself. Okay, so I am the author of this sample, so I know how I find the synonyms, how I find the paraphrasing, how I can trick the students. Okay, so how I make the question so that everybody will not be able to answer quickly. Okay, the time management, people remember time management. Okay, so conventional treatment, if symptoms don't respond to conventional treatment, is there any mention of conventional treatment here in the part C? Any mention of conventional treatment here in part A, B? Is there any mention of conventional treatment? Can you see any word like conventional treatment in part B? In part B, can you see the conventional treatment in part B? No. Okay, no. Okay, no. Now look at this. What does this mean? Refractory, GERD. What does this mean? Refractory. Refractory. Algorithm is steps for diagnosis and treatment of refractory GERD. Okay, refractory. So let me just copy this one here. Okay. So in text B, an algorithm for diagnosis and treatment of refractory GERD. Okay. Refractory. What does refractory means? You should know the synonyms. You should know the synonyms. You should know the paraphrasing. Otherwise, you will not be able to find the answer. What does refractory means? Something that does not respond to normal treatment. Normal mean conventional mean normal treatment. Okay. Conventional mean normal treatment. Okay. If a patient comes to you, to a doctor, to a nurse with heartburn, what you will give? Normal omeprazole for 5 days, 6 days, 4 days. Okay. This is a conventional treatment, or maybe you give any antacids, normal antacids. Okay. Any syrup like this. So if the patient's heartburn does not respond to conventional treatment, you can see also non-pharmacological treatment. Okay. And it means refractory GERD. Okay, so the examiner will not give you the same word, a refractory GERD. Okay, that is why I have changed. Okay, steps to follow when reflex symptoms don't respond to conventional treatment. Okay, so if you are so much scripted, okay, if you just follow what is written there, then you will be trying to find the keyword conventional treatment, conventional treatment. You will not find the conventional treatment throughout four texts. No conventional treatment is written there. There would be refractory jar. So when you match this one, then you can find the answer. Okay, please try to, okay, so try to make logic. Okay, so what is the answer here? Which text? Steps to follow when reflex symptoms don't respond to conventional treatment. What should be the answer? Okay, thank you. Yes, it should be B. Okay, So the answer is B. You can see how the examiner, no, the question is why omeprazole is secreted in breast milk. The question is why omeprazole is secreted in breast milk. In which text it is possible to find the answer? In which text? In which text it is possible to find the answer? Why omeprazole is secreted in breast milk? Why? In which text it is possible? This is what you should have done during skimming and scanning. When I was doing skimming and scanning, I should have some idea, okay? At least you have only shortlisted two text, okay? Maybe C, D, but not in E, not in B. So it is not in A, not in B. It can be in C or D, okay? Okay. So between C and D, if you remember, okay, without reading, okay, if you remember, in C, they are talking about cautions, okay, and in D, they are talking about long-term use and breastfeeding, etc. Okay, breastfeeding and pregnancy. Okay, what do you think? The answer should be in cautions or answer should be in breastfeeding and pregnancy in D. So where is it most likely? Yes. Okay, Saka Khan Vaz, yes, good. Okay, the answer should be most likely in text D. Okay, text D. Okay, text D. Why, Dr. Hirani? Why in C? Why? In C, they are talking about cautions. Cautions. Okay, okay. It can be in D. If we don't find in D, then we can find in C. But first option is to find in D breastfeeding. So this is the logic of doing skimming and scanning. This is the logic of doing skimming and scanning, okay, during first 1 to 2 minutes. So then it would be very easy for you to go quickly where you can find the answer. So our question is why omeprazole is created in breast milk. So we will go there. Okay, safety not established. Okay, not going to have an evaluated potential consequences of use of breastfeeding. There's a molecule strongly suggests safety of use during breastfeeding. High protein branch, okay, indicated that little amount of drug is transferred to the milk duct during breastfeeding. Okay. So why omeprazole is secreted in breast milk? High protein, okay, so a little amount of drug is transferred to the milk. Okay. It can be, the question can be not secreted. Why omeprazole is not secreted in breast milk. Okay. It can be not secreted. Okay. It could be why omeprazole is not secreted, but a small amount is secreted. So you can make the question secreted or not secreted. That is not a problem. So here they are talking about secretion and these things. Okay. Okay. Omeprazole high plasma protein binding rate, 95% indicated that a little amount of drug is transferred to the milk duct during breast milk formation. Okay. So this is the answer why omeprazole is secreted in breast milk. Okay. Why? Because it has high plasma protein binding rate and then small amount is secreted. Okay. So the answer would be text D. Okay. This is just where you find the answer. You don't need to exactly answer the questions. Okay. Now question number 4, where you can find the answer how omeprazole helps in relieving symptoms of reflux. How omeprazole helps in relieving symptoms of reflux. Okay, how? Yes, Dr. Jani, that is good. Okay. Now the question number 4, where you can find the answer. How omeprazole helps in relieving symptoms of reflux, where it is possible. Where it is possible, in which text? B, A, A, B, C, D. Okay, A, B, C, D. Okay, in A, okay, let us try in A. Why, how omeprazole helps in relieving symptoms of reflux? Okay. Anybody know how omeprazole helps in relieving symptoms of reflux? What do they mean? What what they want to ask is mechanism of action. Okay. This is mechanism of action of any medication, how it acts, how it relieves the heartburn symptoms. Okay. So it would be in text A, most probably in A. Okay. Let us try to find in A. Otherwise, we will go for B. Okay. How? Mechanism of action. Dr. Irani, they are asking mechanism of action. Dr. Sadaf Malik, Dr. Irani, they're asking mechanism of action. Okay. Let us try to find an A. If we are not able to find an A, then we will go for B. Okay. Acid is produced, acid is irritant, barrier. Okay. Then we reflex. Okay. The often referred, still they are talking about the acid reflux is produced. Okay. Proton pump inhibitors such as omeprazole stop cells in the lining of the stomach from producing too much acid. This helps to prevent ulcers from forming and assist the healing process that damage has occurred. By decreasing the amount of acid, they help to reduce the symptoms of. Here is the answer in these 3 lines. In these 3 lines is the answer. So it stops cells in the lining of stomachs. You need to, okay. How it helps in relieving symptoms of reflux. It helps in relieving symptoms. Okay. What are the keywords? Relieving and symptoms of reflux. Okay. These are the keywords. Okay. So relieving symptoms of reflux. So where they have written symptoms of reflux here, okay, here is written reduce means reduce, okay, helps reducing the symptoms of reflux such as heartburn, okay, but decreasing the amount of acid. How they decrease the amount of acid? By stopping the cells in the lining of stomach from producing too much acid, okay. So we don't need to give any exact answer here. The main thing is in which text you can find the answer. So the answer should be text A, okay. Text A would be the answer. The next question is question number 5. Mention of the reason for increased tendency of fractures in patients taking PPI. A mention of the reason for increased tendency of fractures in patients taking PPIs. In which text? In which text? Mention of the reason of increased tendency of fractures in patients taking PPI. In C or D? Doctors, long-term use is in D. C is cautions. C is cautions. D has 2 parts. D has 2 parts. Okay. So D has long-term use and D has breastfeeding and pregnancy. This is the D. And C is about cautions. C is about cautions. Okay. In which is possible. Where is possible? In C or D? In C or D? Again, in C or D? This is the problem. When you will spend time to find the answer, they're evaluating you by time management. So time management is very important here. So let us see. So many of you are saying C. Let us see, okay? So the question is a mention of reason of increased tendency of fractures in patients taking PPI. Okay, PPI, Clostridium difficile diarrhea, okay? No mention here. Liver disease, lupus erythematosus, no mention here. Carcinoid tumors, okay? No mention here. Magnesium deficiency, no mention here. Clopidogrel, no mention. Acute nephritis, no. Gastric malignancy, no. Methotrexate, toxicity, temporary withdrawal PPI, high dose measure administration. Okay. Now tell me, can you find the answer? Which bullet point? 1, 2, 3, 4, 5, 6, 7, 8, 9. There are 9 bullet points in questions in which you can find the answer. Is the answer in C or not? Can you find the answer in C? No. There's no mention. There's no mention of increased reason for increased tendency of fractures in patients taking PPI. Now try to find here in text D, okay? In text D. Tell me which line, which paragraph, which line. Which paragraph, which line? Which paragraph, which line in text D, where you can find the answer. The question is, the question is increased tendency of fractures in patients taking PPI. The mention of increased tendency of fractures in patients taking PPI. Okay. So very good. So here is the answer. Long-term use of PPI is associated with decreased calcium absorption, causing increased risk of osteoporosis and fractures. Okay. Increased risk of osteoporosis and fractures. Okay. Here is the answer. And the question is, mention a reason of increased tendency of fractures in patients taking PPI. You people can see what I have done is I have not taken osteoporosis. This is written at the start. So I have taken fractures. Okay. Fractures. One thing very important to keep in mind that these brackets are very, very, very important. Brackets are very, 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 very important. What the brackets are? Very, very, very important. So the brackets are very, very important. Never, never take them light. Okay. So when there is bracket, it means there should be something coming in the questions. Okay. Bracket is very important. Okay. Now, why patients feel symptoms of heartburn? Why? In which text is possible? Why patients feel symptoms of heartburn? In which text it is possible? Why patients feel symptoms of heartburn? Why? In which text is possible? Why patients feel symptoms of heartburn? Why? What is the reason? What is the reason? What is the reason? Okay, in B or A, why patients feel symptoms of heartburn? In which? Why? So which line? Just tell me in text A, which line? Why patients feel symptoms of heartburn? Why? Just in which only one line. Just tell me where, in which paragraph and which line. Just tell me paragraph or line, whatever you can. Okay. Why patients feel symptoms of heartburn? Okay. In which paragraph? Text is A. Text is A, but which paragraph? Second paragraph. No, in second paragraph, no. In second paragraph, no. In second paragraph, no. In second paragraph, they are talking about treatment. How the symptoms are relieved. How the symptoms are relieved. In text A, they're asking why patients feel symptoms of heartburn. Why? Why patients feel symptoms of heartburn? Okay. Why? Okay. Very good. So the answer is here. This is the barrier can be broken down in other people, their problem muscular band. This is why people, this allows the acid to escape and irritate esophagus causing heartburn. Okay. So the answer is here, paragraph text A. Okay. Paragraph 1. Okay. These three last three lines. Okay. So the answer is text A. Okay. The last question in first 7 questions, the last one. No, not every question in text means these 7 questions. Believe me, in these 7 questions, there would be at least 1 or 2 questions that would be difficult to find in which text you can find. Okay. A study related to use of proton pump inhibitors. Believe me, if you are doing this under exam conditions, it would be very difficult to find in which text you can find this question. Very difficult. So most of you will need to read the part A, B, C, and D, all of them to find the answer. This is not easy. A study related to use of proton pump inhibitors, PPIs. A study related to use of proton pump inhibitors, PPIs. In which text? A study related to use of proton pump inhibitors. In which text? C, B, D. You people can see the answers in the chat. C, B, D, B. Okay. C, D. Okay. C, 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 D, B, D. Okay. Try, please. Yes. D, C, D. This is the this is the question where you will waste your time. Believe me. You will spend more than 1 minute, 2 or 3 minutes here. then you at the end you will not be able to complete your 20 questions. This is the strategy the examiner uses. Okay, this sample is made by my own. Okay, you can see this is very easy. Why omeprazole secreted in breast milk? Very easy. It is in text D. How omeprazole helps in relieving symptoms? Very easy in text A. A mention of reasons of increased tendency. Okay, very easy in text D. Why patients feel symptoms of heartburn? Very easy in text A. A study related to use of proton pump inhibitors in which text? In which text? People just give some comments, so please, so that we can find, we can just guess where we can find. Okay, some of you are saying C, some D. Okay, so majority of you are saying C. Okay, let us go to C. Let us try C. Okay, this is C cautions. Okay, PPI is possibly increase clostridium difficile diarrhea reaction, reduce dose in liver disease, cutaneous lupus erythematosus, gastric carcinoid tumors in rats with decreased doses. The risk in humans is unconfirmed, shown to cause okay this munition deficiency. Okay, this can be one study. This can be one study, but we are not sure. Okay, let us keep on hold this part. Okay, may occur in prolonged use. Okay, we may decrease efficiency. This is not a study. This is not a study. This is not a study. This might be study, but still we are not sure this can be the answer or not. Okay, this bullet point can be the study. Okay, so the answer is not and C. Where we should go now? Answer is not and C. Where we should go now? So most of you are saying D also. So now let's go to D. Okay, long-term associated benign, which is okay, cause cancer resolved when PBI discontinued. So So anybody can find the answer here in D, or we should go to other text, A or B. Anybody can find the answer, or we should go to text A or B. Okay. Should we go to other text, or you can find in text D? So Miss Sadaf cannot find in D. So Miss Sadaf, where we should go now? If you cannot find in D, then where we should go? I can show rest of the part. Murozole has high binding protein, 95%. This can be a study. Maybe A. Okay, let's go for A. Very good. Okay. Is how it is produced, then how the proton pump inhibitors they how they help in the relieving the symptoms, and then it is available on prescription. These things there are no mention of any study, nothing in A. No, and B it is not possible. They are not talking about any study here. In B, no, it is in C or D. In C it is not. In C might be this one, this part, but they have not mentioned it is study or not. They have not mentioned the word study here. So then we will go for D. In D, is there any mention of any study? Yeah, very good. Dr. Hussain Hamid Malik. Very good. So Dr. Hussain, one free writing correction for you. Dr. Hussain, when is your exam? One free correction for you, okay? So Dr. Hussain, you can contact me on my WhatsApp after class, one free correction for you, because you are the first one. You are the first one to give the correct answer. So this is a review article in US pharmacist. What is your US pharmacist? What does this mean? What is US pharmacist? What is this? What is US pharmacist in 2030 states that? What does this US pharmacist means? This is a means this is magazine, a journal, okay, like a newspaper, a journal, okay, a magazine, okay, medicine, related to medicine, okay. There was a review article in this which states that the long-term use can do this and that, okay. Sometimes they use review articles, sometimes they use study, something they use evidence, sometimes they use different words, different synonyms for study, okay. So as a study related to use of proton pump emitters. So this is related to their use, long-term use. You can see long-term use. This is a study related to their use, okay. So the answer would be text D. Yeah, a pharmacy company of USA maybe, okay. Article in the US pharmacist, okay. So the answer is in D, okay. You can see people in these 7 questions, so most of the questions would be very easy. You can quickly find in which text there is the answer, means almost 4 or 5. There would be two or three questions that would be difficult to find in which text you can find at least one or two would be very difficult to find in which text you can find the answer. So it is very important to keep an eye on these things, okay. So at the end, okay, so the last thing, if you find this session very useful, please let me know on my WhatsApp. So if you want any changes, anything else, let me know. For tomorrow, what you want to discuss, writing or you can want to continue with reading, okay. Please let me know if you tomorrow you want to continue with reading or you want me discuss some writing points, okay. So nowadays I have limited slots available for my writing course, so VIP hybrid writing course. So you will your 14 letters will be marked, 3 referral letters, 3 urgent letters, 3 discharge letters, 2 letters to non-medical professionals, 1 letter to pediatric patient. In 1 letter, we have 2 patients in 1 letter, and 1 is GP to GP transfer letter. So all types of letter are covered in the course. Okay, for both for doctors and for doctors, GP to GP transfer. For nurses is one community nurse to other community nurse transfer. So the some slots, limited slots are available. If you want to join, try to join quickly, okay. As you know, I was not taking classes for 2 to 3 months. So for the next few days, I will take some students, but then again, I will not be taking students because I'm waiting for my result, okay. Something bad happens, I need to take the exam again, okay. So if you want to join writing or speaking classes, you can join. And if you have any questions, let me know. You can ask me on my WhatsApp number, and let me know in my on my WhatsApp what you want to discuss tomorrow. Reading again or reading writing, okay. Part C, still I don't have my samples. I can discuss part A or B, okay. So I should discuss only my own samples in live class. I cannot discuss any copyright materials. Thank you so much. So on my WhatsApp, please let me know how was the session. If you want to change anything, anything you want me to improve or tomorrow what you want to discuss. So please let me know on my WhatsApp. Thank you so much. If you have any question, you can ask me about your preparation. Okay, about anything that you want to discuss with me, you can contact me on my WhatsApp number. Thank you so much. Thank you.